Good morning everyone. My name is Abdulhamid and today I will present to you an orientation session from the Multicultural Association of Fredericton about health system in Canada and New Brunswick. If you are a Canadian citizen or a permanent resident of Canada, you can apply for public health insurance, which cover most of the healthcare services. Each province has their own health insurance plan. In New Brunswick, we have New Brunswick Medicare plan. When you have a permanent accommodation and you have a permanent address in New Brunswick, you can apply for the Medicare coverage. And you can do this in the office of the service New Brunswick. And you will receive the Medicare card, which shown in the slide. And when you go for any healthcare services, you need to provide them with this Medicare card. What are the services which are covered by the Medicare plan? Visit to healthcare provider, including family doctor, nurse practitioner, necessary medical procedure, hospital services such as operation, blood tests, X-rays, and deliveries. What are the services which are not covered by the Medicare plan? Drugs. So if you need drugs for your treatment, you need to have another health coverage to cover the cost of the drugs. Ambulance service, vision care, dental care, cosmetic procedures such as removal of skin mole. Circumcision, if you're doing it for religious cause, will not be covered, but if it is done for health related causes will be covered. Complete medical examination as annual check-up will not be covered. If you need examination, immunization, and services for the purpose of employment, travel, immigration, insurance also will not be covered. If you arrive to Canada as a refugee, the federal government will give you a health coverage plan. This health coverage plan, we call it Interim Federal Health, IFH program. It is a limited and temporary health insurance from the federal government. It is issued for the refugee on arrival to Canada. It covers the period before the Medicare coverage start, and also it will cover you for 1 year from the date of arrival to Canada. What are the services which are covered by the IFH insurance? Prescription drug, hospital services, services from medical doctor, registered nurse, and other healthcare professional, and also covers the pre- and postnatal care. Blood test, diagnostic X-rays, ambulance service, all this also will be covered by the IFH. Vision care, dental care, if you need home care or long-term care at home, all this will be covered by the IFH. Services provided by psychologists, occupational therapist, physiotherapist will be covered by the IFH. If you need assistive device such as hearing aid or you need diabetic supplies, also this can be covered by the IFH. Now we will talk about the healthcare provider in Canada. In Canada, we have two groups of healthcare provider. The first one, primary healthcare provider. This includes registered nurse, nurse practitioner, family doctor, and we have a specialist doctor. And in the specialist doctor group, you have many specialists, depending on the field of expertise. So most of the services will be provided by the primary healthcare provider, and if they feel you need to be referred to a specialist doctor, they will refer you. And as I mentioned, we have many specialists depending on the field of expertise. For example, if you have problem in your bone, you will be referred to orthopedic specialist, and so on. So you will be treated by the primary health care provider, and if they feel you need referral to a specialist doctor, they will refer you. You cannot go to a specialist doctor without referral from the primary health care provider. So you will need to register with a family doctor, but you will do this, and we will talk about later, through calling 811 phone number or through the website. This will take some time. So they will put your name on waiting list, and when there is available family doctor, they will register you with this doctor. So what you can do if you have any health issue and you don't have family doctor. In Fredericton, we have many clinic. We call them after-hour clinic or walk-in clinic. And in this clinic, there is family doctor who can serve you till you have your own family doctor. The operating system in this clinic, they serve patient on a first come, first serve basis. This means they have certain number of patients they see every day, and when they finish this number, they will not accept any more patients. They will require you to go and register your name to have appointment. The family doctor in this clinic will not have any information about your health history. So if you have any health problem like allergy, you taking any drugs, you have high blood sugar, high blood pressure, you need to inform the doctor about your health history. The operating system in this clinic used to be you go to the clinic and they will see you in person. But currently we have something we call it COVID-19 pandemic, which I will mention a bit later. And to reduce the risk of infection to people, this clinic operate in different way. So what you can do now to access this clinic, you need to call the clinic, and the secretary of the clinic will take some contact information from you, and she will take your home address, your Medicare number, and ask you about your problem. Later, the doctor will call you back, and either he will treat you over the phone or will order some test for you to be done in the hospital, or he will ask you to come to the clinic to see you. Another clinic, New Maryland After Hour Clinic, operate from Monday to Friday 4 p.m. to 9 p.m. To book appointment, you need to call 506-458-8927. The clinic location in New Maryland. Another clinic in the north, Marysville Walk-in Clinic, operate from Monday to Friday 8 a.m. to 12 p.m. The clinic located in Canada Street. To book appointment, you need to call them on 506-449-1653. So all these after hour and walk-in clinic, in the beginning, we can help you to reach them and to book appointment there. So the only thing you need to do, you contact your case manager and he will guide you how to book appointment there. Now we will talk about different type of clinic. They are not walk-in clinic. This means you cannot go without appointment to be seen in this clinic. You need to be registered there and they need to give you appointment. Then after this you can access their service. So the first clinic is Fredericton Downtown Community Health Center. Multicultural Association have a partnership with this clinic, and we send all the newcomer to this clinic to have initial health screening, to have immunization. So a lot of services they provide to the newcomer. This clinic provide a lot of health services, but again you need to schedule appointment with healthcare provider before you can access their service. And also in the beginning we can help you to book appointment in this clinic. They provide wide range of health services, and they have a health team made of doctors, family doctors and nurse practitioner, diabetic nurses, physiotherapists, respiratory therapists, social workers, and also they provide a lot of community health services. They are located in King Street. Their phone 506-452-5900. They operate from Monday, Thursday 8 a.m. to 8 p.m. and on Friday from 8:30 till 6:30. Another clinic, Gibson Health Center. This one located in the north area, and they have again a same care team made of family doctors, nurse practitioner, and practical nurses, and they have dietitian, respiratory therapist, and they provide a lot of educational session about wellness and health. They are located in the north in Brookside Drive. To access them, the phone 506-447-4444, operating from Monday, Friday 8:30 to 4:30. But again, this clinic, you need to be registered with them, and they give you appointment date, then you can access their service. And we can help you in the beginning to access this clinic. Another clinic, Noreen Richard Health Center. It is primary health care services, and they focus mainly on the minority of Francophone residents. And we mean by Francophone, people who speak French. And they have health team made of physician, nurse practitioner, social worker, dietitian, respiratory services, and also they provide a lot of community educational session about health and wellness. They are located in Brisbane Street, phone 506-474-4611, operating Monday to Friday 8 a.m. to 4 p.m. and have some evening appointment on Tuesday and Thursday. Another health services, they call it Fredericton Addiction and Mental Health Service. This service specializes in mental health issues such as addiction treatment, counseling service, therapeutic groups. And the location of these health services in Brunswick Street, their phone 506-453-2132, and operating hours Monday, Friday, 8:15, 4:30. You need to go to the health center, and they will do intake for you. They will take your information, and they will check what is your issue, and they will put your name in the waiting list, and you will be seen according to the urgency of your situation. Another public health clinic, Fredericton Public Health Clinic. This clinic located also in the north, and this clinic provides service related to promoting healthy lifestyle, environmental protection, and also they deal with what we call it communicable disease. And we mean by communicable disease, any disease which can spread in the community. So they are located in 300 St. Mary, Suite 1200, and they have another branch deal with sexual health program located in Regent Street in 1113 Regent Street. Their phone 506-453-5200, operating from 8:30 to 4:30 Monday to Friday. So now we finish the after hour clinic and we finish the regular clinic. We will talk about hospitals. In Fredericton we have Dr. Everet Chalmers Regional Hospital, and this hospital is the only hospital in Fredericton, and this hospital provide wide range of health services. They are located in 700 Brisbane Street. Their phone number 506-452-5400, and they operating 24 hours a day, 7 days a week, including weekends and public holidays. So this hospital, if your doctor refer you for any test or any investigation in this hospital, you will receive a letter by the mail, including the test you need to do, the date, the time, and you need to take this letter with your Medicare card, go to the hospital and do the required test. After you do the test, the result will be sent to your doctor, and your doctor will inform you about the result. Inside this hospital, they have what we call it emergency room, the ER, which is designed to receive any patient having any health emergency. So anyone have any health emergency, 24 hours a day, 7 days a week, including weekends and public holidays, can go to the emergency room so he can receive services for his emergency condition. Another hospital which is located on Oromocto, this hospital provide inpatient services, family practice, palliative care, rehabilitation, surgical center, screening services for cancer, emergency department, and they are located on Oromocto. And the phone 506-357-4700. Emergency department open from 8 a.m. to 10 p.m. daily. So this is the two hospital in nearby. So the first one in Fredericton, the second one in Oromocto. We mentioned that in the hospital they have emergency service, and this emergency service receive patients who have any emergency health issues. So what we mean by emergency? Emergencies sometimes are confusing. It is not always clear it is emergency or not. So if you think you have any emergency at home, you can call 911. And if you have any health issues and you're not sure it is emergency or not, you can call 811 and get advice, or you can call your settlement worker and get advice from them. When you call 911, you will be connected to the police, ambulance service, fire department, and all of them will go to your address to check your emergency and deal with it. Now we give some examples of what we mean by health emergency. Health emergency mean heart attack, asthma, someone cannot breathe, someone have allergy, severe allergy, someone drinks poison, or have cut and bleed, or choke while he's eating, or fell and have broken bones. All these consider health emergency. And if you have any health emergency, you can go to the emergency department and they can treat you. Now we will talk about pharmacy, the place where you get your drugs. In the pharmacy, there is two groups of drugs. The first one we call it prescription drugs, and this drug, to receive this drug, you need prescription from doctor, and you take it to the pharmacy and you will get the drug. The other group of drug, they call it over the counter, which does not need prescription. So for prescription drugs, you need to go to the pharmacy and you take with you your Medicare plan, and you need to take your doctor prescription, and you need to take any health insurance such as IFH to cover the cost of the drug. Over-the-counter drugs, as we mentioned, you don't need doctor prescription. Pharmacists in the pharmacy can help you, and these prescription drugs usually not covered by the health insurance. We just mentioned that when you come and you settle and you have Medicare plan and you have permanent address in New Brunswick, you can register your name to have a family doctor. So how you can do this? You need to call this number 811, and they will take your contact information and they will put you in the waiting list for a family doctor. And when family doctor is available, they will call you and they will register you with this family doctor. And you can do the same registration through the website shown on the screen. So this 811 number, we call it New Brunswick Telecare number. It is free confidential health service and information line. When you call 811, you will have access to bilingual registered nurses, so she can speak English and French, and they will access you 24 hours a day, 7 days a week. And they will take your contact information, your number, and your complaint, what is your problem, and they can give you advice about your health services. I just mentioned a few minutes ago that currently we have what we call it COVID-19 pandemic. So what we mean by this COVID-19 pandemic? It is virus infection which is spread in many countries all over the world, and they call it COVID-19. And when you have this virus infection, you can have one or more of the following symptoms: fever, cough, sore throat, running nose, headache, fatigue, muscle aches, diarrhea, loss of taste or smell. In children, bearable marking on the finger and the toes. So these are some of the symptoms which people can get when they have this infection. So to prevent the risk of getting this infection, what you need to do? The first thing is wash your hand frequently. You can do this with warm water and soap for at least 20 seconds. If you have no access to this, you can use hand sanitizer with at least 70% alcohol. And also rub it in your hand about 20 seconds. What else you can do? When you're in the street, always try to maintain what they call it social distancing. At least try to stay away from other people about 2 meters, and this will reduce the risk of you getting infection from others. What else you can do? Cough etiquette. So when you cough or sneeze, cover your mouth and nose with tissue and discard them in the garbage immediately and wash your hand to get rid of any virus in your hand. If you're outside and like shopping area and you cannot maintain this 2 meter social distancing, it is good advice to wear mask, which can cover your nose and mouth, and this can give some protection from the infection. So if you feel you have some of these symptoms which I mentioned before, what you can do, you need to call the number 811 and tell them what you have and follow their advice. So either they will tell you you need to come for testing to check you have the virus or not, or they will tell you just to stay at home or go to hospital. So you just call the number, give them the information and follow their advice. Now we reach to the end of this orientation session. I hope it was useful information, and there will be some time for any comment or any questions from you. Thank you.